Hello, welcome back to a new episode of MiM Podcast. Today we are talking about a topic which is really interesting. We find it really difficult to talk about it. We have a special guest today. It is Dr. Khalid Abbas, urologist specialist. Welcome, Doctor.
Thank you very much for your invitation.
How are you?
I'm fine, thanks.
Doctor, can you introduce yourself to our audience?
Yes, I'm Dr. Khalid Abbas. I'm a specialist urologist. I have graduated and I have a certificate of Arabic board of being a generalized urologist. And I have a specialization. I have a subspecialty of andrology and male health, which is a subspecialty after taking the board. Yeah,
that's good. So guys, today we are talking about erectile dysfunction. So Dr. Khalid, can you tell us what is erectile dysfunction? Why does it happen?
Okay. Erectile dysfunction is defined as inability to obtain or maintain erectile erection. So if any guy has the inability to obtain or he have ability to obtain but cannot maintain the erection, this is included within the definition of erectile dysfunction. We abbreviated it as ED. Okay, so I'm going to talk about ED along with the discussion. So ED means erectile dysfunction.
Doctor, if you notice that erectile dysfunction is a disease which is really hard in cultures to talk about it, especially in our cultures. Man doesn't want to talk about it.
Yeah.
So in these cases, how we will solve it? How we will handle the situation?
Okay, actually, we face that before maybe 10 years. There was a very big difficulty to speak about ED. You know, the manhood, the mentality of men is different than the mentality of women. So we still feel that there is some sort of embarrassment, and most of the men may argue or claim that they are good. They don't want to face this problem. Well, actually, maybe in the Western countries, it's a bit more educated about that. They don't feel that it's a sort of embarrassment. It's a problem that seeks help. But nowadays we feel that the people are more aware. Still, we have seen a lot of good approaches to seek help about this. Every problem in this field is solvable. We don't have any problem without solutions. But the problem is, the man should seek the help, should come and seek the help. The problem is when the man denies the problem. Okay, so when denies the problem, the issues will get worse.
I understood, Doctor. Thank you. Doctor, what is the common causes of erectile dysfunction? Is it related to age?
Yeah, well, we can subgroup this into younger age group and older age group. In younger age groups, we have two main categories. The first category is the psychogenic cause, the psychological cause. Well, in young age group, the most common causes are the psychological causes of erectile dysfunction. That doesn't mean that we don't have an organic cause. Organic causes, opposite to the psychological causes, means that we have a problem. The problem might be hormonal, might be related to the nerves, might be related to the arteries, might be related to the cavernous tissue, which is the tissue inside the penis. And these all, we call it organic. Maybe it's venous or arterial or nervous. This is called organic causes of ED. In the contrary, we see psychological causes. So psychological causes are the most common causes in younger age group. Organic causes are the most common causes in the elder age group. Well, worldwide, about 21% of population have ED, we can see that this is
It's a
approaching,
huge
yes,
percentage.
20%. And during aging, we see about 50% of aged person have ED. But the problem is that not all of them claim or seek attention to that. Sometimes we feel that man feels embarrassed. He's accepting the problem. He's accepting the problem inside himself. And if we accept the problem inside the self, we should accept it, and there will not be it will be difficult to have the solution. So 50%, about 50% elder age group, but we see it less, of course, in younger age groups.
So
Yeah.
that's good.
Yeah.
Doctor, you said psychologically it can cause the erectile dysfunction. So those patients who have erectile dysfunction, how their psychologically goes on?
Yeah, look, when we talk about psychological, it's related to different things. Maybe it's related to anxiety, depression, feeling of less self-confidence. We feel that some of the couples have a problem, emotional distraction. Sometimes we feel that couples or when they come, they have a problem in understanding the sexual life. These are all included within the psychological cause. Sometimes there is a fear. Sometimes there is, let's say, feeling strange about sexual life. There is no any education. These are all included within the psychological causes of ED. Of course, when a patient comes, we should consider all the causes, even if he's younger age group, because we can see organic causes in younger age group. The life is different. Bad lifestyle is present in our community. We are seeing diseases happening in younger age groups. So we can't say any younger age group has a psychological ED. Sometimes we see both of the causes inside one person. Okay, so this acquires full lookout. It needs a matter of experience, specialization, and we need to seek about all the causes. Actually, sometimes when a man comes, now there is a bit education. Like some families coming both. The wife will come with the man. Some likes to come alone. We respect the mentality of the community. Man can come alone most of the cases, seek help. Some of the families now are coming together. This is some sort of education, no matter if a couple do it. Okay, this will help me know how what is happening. Okay, it will give me more information because I'm hearing from both sides. Okay. Yes.
Understood. Doctor, why does getting and keeping erection go wrong?
Yeah, look, let's say that there is some of organic causes. One of the organic causes is called venous leak. Okay, now venous leak has multiple causes. Sometimes the man have an erection, but it goes fast. It goes wrong. There is no ability to maintain the erection. It's one of the organic causes. The venous leak could happen due to previous trauma, previous wrong sex. It could be idiopathic, means no any identifiable cause. It could be done due to diabetes mellitus. Some of the diseases related to the veins. We can see this problem actually. It's not so common, but it's present. This is one of the things that make the erection goes wrong. I mean, there is an erection, but it will not maintain for a long time. It is one of the organic causes that needs conservative treatment at the first, because we see that there is some of the patients respond to conservative treatment. But some of the patient will require surgical intervention for this condition. So we see most of the patients of ED, they have there is a conservative solution for them. If they come early, but severe ED, organic causes, severe ED, ultimately, if we neglect everything, will lead us to the surgical solution, okay, which is implantation of penile prosthesis, okay, which is a wide subject. It has a lot of details. Now, most of the people know it. It is a surgical solution for the end stage of ED, non-responding to any type of conservative treatment. We go with the surgical treatment when we see that there is no any solution. Of course, this now is considered one of the solutions, the huge solutions that stabilizes the family. It is satisfactory for the man, satisfactory for the wife. Don't hesitate to seek medical help before reaching this point. This is my advice to all people.
Doctor, a lot of people think that erectile dysfunction only happens in older men. Is it really true?
No, it's not true. Most of the men, they feel now happy with the sexual life. But ED now is considered a problem of youth also. If you found any problem happening and it's going on without knowing the reason, seek the help of your doctor, because it's preventable. This thing is preventable. You can reach life, you can reach a longer age without any problem. But if you don't neglect such important things in your habits, no, ED will come early.
This lifestyle,
of course,
can be cause of erectile dysfunction in younger men.
Look, let me tell you something. ED, erectile dysfunction, is similar to the heart disease. Okay, ED is dependable on arteries. We have arteries coming, giving the blood to the area. So what makes these small arteries having a problem is the same thing that makes the big arteries having the problem. Okay, there is a close relation between the heart disease and the penile artery disease. Okay, it's not different. It's the same risk factors: smoking, alcohol consumption.
So these are the reasons, the causes of having erectile dysfunction in younger.
Obesity, sedentary lifestyle. If we neglect everything, if we go with obesity, high cholesterol level, these are the same factors that make you die earlier. It's the same factors that make you going to ED for arterial causes. I'm not speaking about the nervous causes and the venous causes, and I'm talking about the arterial insufficiency, meaning that the arteries are not giving a lot of blood to the penis. We need blood to come inside the penis for erection, but this is not happening for cases of obesity. And we can face, if you heard about some younger age groups having heart attack, 35, 33, and he has a heart attack. Now, we can hear about that in the hospitals. The same thing. Now, the arteries in the genital area of the man, they are more smaller than the big arteries. They can close or have an arterial insufficiency earlier than the heart disease. Maybe this estimate is about 3 to 5 years. If we have a closure in the arteries, small arteries, maybe after 5 years we have a closure in the large arteries. So, ED is an alarm for arterial insufficiency. ED is an alarm for heart disease. Now, for example, patient come to me. You have an arterial insufficiency. When I see that the arteries are not closed, I'll have an alarm that you will have a heart problem after 5 years. So this will be, it's a life, it's not just a pleasure thing. Look about the point as if it's your life. Not only it's a matter of just a pleasure. Men should really think about it as a generalized condition. It's not far away from life, from your health and life. We see both of the problems coming together. Its ED is considered an alarm for heart disease. This is a very important point to understand. We don't have separate things in medicine, but it's one of the problems. We can have a localized problem in our sexual life, but it might be related to our hearts. This is the point I want people to understand.
So in these situations, what will you do, doctor?
We'll
How you
do
will
a full.
handle it?
Okay, we'll do full investigations for that. We need to do full investigation to check a blood pressure, to check the serum cholesterol, what is high, what is low, and to manage it from now. If it's manageable, we should swift to strict follow-up with changing lifestyle. If you have a smoking, quit it from now. If you have high blood pressure, manage it. If you have elevated serum cholesterol, lower it. If you have sedentary lifestyle, go to the gym. Okay. If you have obesity, do anything to get rid of obesity. If you don't do that, you will surrender to the problem, and the problem will not be fixed. We will go year by year to end stage erectile dysfunction, and only surgery will be the solution. If one likes the surgery, he will surrender to this problem, and no any medicine will be could fix the problem. We have seen that, okay, now we have conservative treatment patient, most of the patient responding to treatments, we will go to the treatment. But if we reach a point that the conservative management is not possible, surgery will be the ultimate solution.
So, doctor, could you give us a story, talk about a story without giving a name that the patient struggled with ED?
Yeah.
How you manage it?
Okay. Well, first of all, I should check about the cause. Now, any doctor, the duties of the doctor is to search about the cause. How can we search by the cause? History taking. We should take a full history, sitting with the patient about 15 minutes, full detailed history, sexual life with the wife, what's going on. We'll ask about the morning erection. We'll ask about. Then we will go to the after taking the full history, we go to the examination. It's very important to examine, to see if there is any fibrosis, any localized problems, and to take the length, the girth. These are the things that we do in our job as a subspecialty. After that, I'm going to send investigations. We should take full investigation, check blood pressure, see if there is any problem. We will go to do serum testosterone level. We will check this lipid profile, the HbA1c, which is the investigation of diabetes. All these should be checked. If there is an organic problem, we will focus on it. Okay, we'll start medical management. There are a lot of medical managements, treatments, tabs at the first. If it's not beneficial, there is injections. We have also another sort of management, which is the PRP, or the external shockwave treatment. But these are reserved for mild cases of ED, and it's somehow helpful for those with mild ED. We will estimate that. We can give you also a questionnaire to answer some questions to identify what's called the erectile function score index, which is an index used to full sum of questions. It has a grading from 5 to 25. We will estimate the degree of the erectile dysfunction. Once everything established, we will say that the patient can go with conservative treatment. He might need medicines, he might need injections, he might need shockwave or even PRP, or we see that the patient must sometimes come with sometimes we need to do ultrasound for the arteries. Okay, if we see a matter of blockage or severe venous leak, even from the first visit, we here go with the conservative treatment, but we will not suspect a very huge change. Sometimes we will go to surgical intervention to solve the problem. I have families coming with end-stage ED, and there is a matter of even divorce problems coming in lives. So we go rapidly to rush to find the solution for such conditions. We go with surgical intervention when we see that the patient has no any response to the medication, and we want to solve the problem of these families.
So, doctor, is it so scary? This erectile dysfunction can it cause it die?
No. Look, just the matter of arterial insufficiency. The ED itself, it doesn't cause death, but I want to pay attention to the cause of arterial insufficiency, because arterial insufficiency is related to the heart disease. Okay. Now, most of the treatments we give, they don't cause death. We know how to give the dosage. Sometimes people fear about taking the medicine. They feel that one of the guys took Viagra and he died. Well, this could happen if we don't know what is going on in the heart. The doctor
not using medicine.
Don't use medicine. Don't use
prescription
medicine
of
without
doctor.
prescription. This is a very big fault that our community do it. They go to the pharmacy, say, I want Viagra, I want Cialis, and the pharmacies actually, what's one of the big problems we face, they give it without prescription. Now, if one of the big prohibition of taking these, if you are taking sublingual tabs for angina, these are vasodilators, okay? And vasodilators means that you are going to open the arteries, and these can lower the blood pressure. They are vasodilators. Some take sublingual tabs. You know, patient having angina or heart problems, heart pain, and they need these treatments. The doctor of heart, the cardiologist have wrote it for those. It's very prohibited to take Viagra for such person taking sublingual or any vasodilators of the heart. Because why? Because Viagra and Cialis, they will also cause vasodilatation. So there will be synergistic effect with this tab, and you may face a very rapid loss of blood pressure, and this can cause death. Okay, so there is a fear, of course. I don't want people to go rush to the pharmacies taking the tab. You seek your medical advice. Let the doctor prescribe you, and let the doctor follow up you. It's not worthy to go to the pharmacy and take the tab and risk your life, right? About just having a pleasure. We have heard some problems about that. Don't take the tablets in a very huge amount. I'll talk about one of the stories, which is very sad story. I think it happened in Baghdad or in any other place. Now, you know, these tablets, because they are wide in community, people go and people go and they take it. Now, as a joke, you know, between youth, always there is joke about this point. It was a birthday of one of the guys. Okay, his friends wanted to joke with this guy. They did a cake. Okay. The cake was full of sildenafil. You know, they put sildenafil, which is Viagra. Okay, no, we call it the blue tab, or
as a surprise.
Yeah, the blue. As a surprise, they did a cake full of Viagra. Okay, the maximum dose of Viagra is 100 milligrams. Imagine you put how many 100 milligrams is put inside the cake. Now the guy he ate the cake, and he got rapidly to the emergency. There was no way to rescue him, and he died in his birthday because of this joke. Okay, so I think there is a matter of education, actually. People think that these tablets are safe. No, these tablets, they are vasodilators. They open the blood vessels. So do you need to open your blood vessels? Let the doctor know. Don't open your blood vessels. You don't know the condition. Okay, so maybe this guy had a very massive dose of sildenafil. Maybe he has a heart problem. We don't know the condition, but ultimately, because of the joke, because of the uneducation, ultimately this guy died because of his friends.
Unfortunately,
Yeah.
doctor, we have too many cases nowadays. They are going to pharmacy taking medicine without even seeing doctor.
Yeah. This
We
is the
find
problem.
it too many cases like that.
Yeah.
And it causes too many problems.
Yeah, of course. We are facing that. I face that a lot. Sometimes I see they take tablets. Even, there is a problem now. There is a problem with one of the kinds of honey. The honey also, they sell
They sell
honey.
it in the pharmacy.
Yeah,
This honey, I
now
know.
this
I
honey,
saw it.
the problem in this honey, now I want to focus about the quality control, of course. Now, how much this honey is also we have phosphodiesterase inhibitors inside it, ultimately, because how it's doing its effect. You take a honey and you got erection after the honey directly. So this is a medicine. It's not a...
So, doctor, what is your message to men who are silently struggling with erectile dysfunction, but feeling embarrassing to seek help?
Okay. My first advice is don't think that doctors are like in the court or doing judgment to the people. They are for you to help. Sometimes when a man come to me, he speaks as if I'm going to judge him. Okay, this I don't want to feel. We want to say that we are with you. Don't feel embarrassed. Now the community is developed and medicine is developed. There is a lot of solutions. Try to confess that you have a problem. The doctor is not a judge. He will not blame you. He will not tell you that you have a problem and what you're doing. No, he will try to help you. Okay, so if you understand this idea, you will realize the importance of visiting your doctor. Okay, if you feel that your doctor has a lot of experience about this point, go visit him. Don't leave the problems go on and without any facing the problem. Don't deny the problem. Okay, anything in life, if you deny the problem will not end in any aspect of life. In this point, the same thing. Don't deny the problem. Just tell your doctor what you have, and he will try to solve it with you. He will solve it as a friend, not as a judge or something like this. This is my advice.
Thank you so much. Thank you for giving your appreciate time. Thank you, doctor. It was really an interesting topic that we should really talk about it.
Thank you.
Thank you for our listeners, for our audience, for listening and supporting. See you in the next episode. Take care. Be safe.